Okay, I'm not going to be able to cover everything there is to cover about community care, but I do want to talk about some of the basics that you should be aware of. And just to make sure we're all on the same page here, when I say community care, I'm talking about VA medical care paid for by the VA, but not at a VA hospital or clinic. So first of all, always get community care approved by the VA ahead of time, unless it's a medical emergency or an urgent care type situation. And I'll get into both of those in a minute. But if you are dealing with a chronic medical problem, or if it's a new problem that just popped up, but it's not immediately life-threatening, you've got no excuse. Contact the VA, get it approved ahead of time, and get proof of that approval. So to do that, the VA will typically mail you a letter with your confirmation number and other information. But you can also find this online. So log on to va.gov, follow the links to your medical records, and get to your VA Blue Button report, and it should be in there. I know I can find mine in there. Sometimes it might take a few days for the referral to show up in your records, but it should be there. I've made a video about how to access your VA medical records, which I'll link to below, but I've gotten a little off track. So if you do go somewhere for medical care without prior approval, don't kid yourself. You're taking a big risk. So ask yourself ahead of time, can I pay for this visit or treatment or whatever it is out of my own pocket? And if the answer is no, and it's not a medical emergency, please consider waiting on that approval from the VA ahead of time. You'll save yourself so much headache down the road. Okay, so what about medical emergencies? If you are receiving VA healthcare for a service-connected disability, or you've been seen by the VA for your healthcare, even if it's just an annual checkup, sometime in the last 2 years, the VA will pay for emergency medical care as long as your medical situation, hold on, I gotta read this to make sure I get it right, is such that a prudent layperson would reasonably expect that a delay in seeking immediate medical attention would be hazardous to your life or health. All right, so the key phrase in there, what does a prudent layperson reasonably expect? If a normal, reasonable person would think that your situation was an emergency, that's the standard the VA is going to look at. Also, once you're in the ER and stabilized, expect that the VA will try to move you to a VA hospital. If you refuse that transfer, the VA is no longer going to pay for your treatment. Also, note that it is very important that you contact the VA within 72 hours to let them know that you are in or went to the emergency room. Now, this part is important, although it might not be a deal breaker as far as the VA paying for it. The best thing I can say is think about who are the people who are going to show up in the ER, once they find out that you are in the ER. And make sure that those people know that the VA needs to be notified, because you may not be able to do it yourself. And if you can't give the hospital your insurance information and telling them that they need to contact the VA to get paid, then they may not do it either. So if you can, you should do it, but have family and friends lined up to make that call. Okay, what about urgent care? With urgent care, there are two big things to be aware of. First, you have to make sure that you have been seen by your VA primary care team at some point in the last 2 years. So as long as you are getting your annual checkup from the VA, you should be fine. Second, you have to make sure that the urgent care provider you go to is approved by the VA. And again, do this ahead of time, or you're going to be stuck with the bill. So I will put a link below to a VA's website where you can search in your area and find all the urgent care providers. I've used this program personally, and I've had no problems at all with it. So it is possible to make that work. However, if you're in doubt, go ahead and call the VA first and ask them if it's okay for you to go to an urgent care for whatever you've got going on. All right, for any of this treatment, it's important to remember that depending on your situation with the VA may charge you a copay. Now, if they do, the VA will bill you for that separately later. And I should add again that if you haven't been to a VA hospital or clinic in the last 2 years for some type of medical treatment, don't expect the VA to pay for your community care. There is so much more that could be said about this topic. This video only covers the basics, but I do hope it was helpful for that. Even though this video wasn't about disabilities specifically, if you'd like me to help you with your disability claims, you can reach out to me through the links below. I'm Al Walsh, a veteran who likes to help other veterans. Thanks for watching.